So for the Pasteurella multi-sided topics, if you just learn the specific serotypes and then learn which topics to apply them to, you will know all the topics. So Pasteurella multi-sided A is found in the upper respiratory tract. It is a facultative pathogen. It's an epiphyte. It lives there. But when there's predisposing factors, it'll travel down to the lower respiratory tract. And from here, it'll cause pneumonia and cause clinical signs such as cough, nasal discharge, and dyspnea. In cattle and swine, the disease is localized to the lungs. However, in birds and rabbits, it can also spread to the middle ear, which can then cause head tilting, as well as spreading to the joints, which causes arthritis. However, in birds in acute cases, Pasteurella multi-sided A behaves like Pasteurella multi-sided B2 and E2, which we will talk about in a second, and in sheep, it can behave like either or. So Pasteurella multi-sided B2 and E2 are found in tropical regions. B2 is found in Asia, and E2 is found in Africa. So the bacteria exists in the upper respiratory tract, and when there's predisposing factors, it'll then spread to the blood. However, in the blood, the bacteria can go undetected by white blood cells because it has hyaluronic acid in the capsule. This allows the bacteria to replicate intensely, but eventually the bacteria will be lysed by the immune system, and then the LPS endotoxin will be released, and this will cause hemorrhages. This is because LPS increases the permeability of endothelial cells, which leads to edema. It also causes an activation of the coagulation cascade, which leads to coagulopathy. These animals will have dyspnea as well as edema, as well as cyanosis and necrosis in the parenchymal organs. And for Pasteurella multi-sided D, it produces dermonecrotoxin if there's predisposing factors, and this inhibits osteoblasts. This means there's no new bone formation, and then osteoclasts will eventually break down the bones. And in rabbits, it can cause skin necrosis. And Mannheimia hemolytica produces leukotoxin. This causes fibrinous pneumonia and fibrinous pleuritis. And for treating Pasteurella multisida, you give macrolides and penicillins. Penicillins typically work on gram-positive bacteria. However, the LPS is so thin that they also work on Pasteurella multisida. Obviously, this doesn't work in the case where there's an endotoxin effect, such as B2 or E2, as the animals will die before you can treat them. So it's important to know, for the poultry topics and for atrophic rhinitis, you do not treat with macrolides or penicillins. You treat with tetracyclines. Also, another useful bit of information is you can give inactivated vaccines for all the Pasteurella topics. But you can also give toxoid vaccines wherever there is a toxin, such as dermonecrotoxin in the case of Pasteurella multisided D in atrophic rhinitis, and for leukotoxins in the case of Mannheimia hemolytica, which is all the ruminant topics, because only ruminants can get Mannheimia hemolytica. So as we go through the topics, Pasteurella of cattle. This is Pasteurella multisided A, so we know it's localized in the lung, and Mannheimia hemolytica. This is how we know we get fibrinous pneumonia and fibrinous pleuritis. In this topic, also talk about shipping fever and bovine respiratory disease complex. For shipping fever, they become immunocompromised from the stress of being moved around, and for bovine respiratory disease complex, it's from viruses, as well as overcrowding, bad hygiene, etc. The Mannheimia hemolytica is A1 and A2, just remember that. For the next topic, hemorrhagic septicemia of cattle, it's Pasteurella multisida B2 and E2. It affects cattle and buffalo between the ages of 6 months and 2 years. So we know the bacteria spreads to the blood, they get shock, and they die. For Pasteurella multisida of sheep and goats, we have Pasteurella multisida A, and also mentioned D and F, but we're only talking about A. In this topic, you need to talk about the respiratory form and the septicemic form. In the respiratory form, it's the exact same as this, Pasteurella multisida A. However, as we mentioned previously, sheep can also get the hemorrhagic form of Pasteurella multisida A. So respiratory is between month 1 and 5, and septicemia is under 3 months. In this topic, we also have to talk about Mannheimia hemolytica, A1, A2, A6, A9. Sheep and goats can actually get mastitis from Mannheimia hemolytica. It's through an ascending infection when the lamb is suckling on the mother, but they don't die, they just get mastitis. This is because Mannheimia hemolytica, just like Pasteurella multisida, is localized in the upper respiratory tract. And the fourth form is just acute systemic disease. It's caused by Bieberstania trehalose. This is just another type of bacteria that lives on the tonsils. If there's predisposing factors, an embolism will form, and this will block the kidneys and lungs, and the animal will die. It happens when they're 3 or 12 months old. And for the next topic, swine and rabbits. In swine, they get Pasteurella multisida A, so nothing unusual here, just localized in the lungs. And in Asia, they can get Pasteurella multisida B2, so this is the hemorrhagic form. And for rabbits, they get Pasteurella multisida A, So nothing unusual here. They also get conjunctivitis, and as we mentioned earlier, it can go to the middle ear, which can cause head tilt. And you also have to mention that rabbits can get Pasteurella multisida D and F, but it's nothing unusual. The dermonecrotoxin can cause skin necrosis in rabbits, but nothing other than that. And for atrophic rhinitis, it's caused by Pasteurella multisida D, as mentioned here. But you also need to mention that it is also caused by Bordetella bronchoseptica, which causes atrophy of the turbinates. And then it's combined with Pasteurella multisida D, and this inhibits the osteoblasts, as previously mentioned, which will cause the pig to have a short, shrunken nose, and this will mess up its teeth, and it'll have nasal discharge. This part is irreversible. However, atrophy of the turbinates caused by Bordetella bronchoseptica is reversible. There are two forms of the disease: non-progressive when they're young, between 1 and 4 weeks old, so not much has happened here, and when it's progressive, when they're over 3 months. This means the bacteria have had time to destroy the nose. And for the next topic, fowl cholera, is caused by Pasteurella multisida A, but as we remember for birds, their form of Pasteurella multisida A is actually a hemorrhagic form. So in an acute form, it basically acts like B2 and E2. The bacteria gets into the blood, it's lysed, and then it causes hemorrhages. But in the acute form, they also have respiratory symptoms, as well as diarrhea, which is not seen in any other Pasteurella disease. And in the chronic form of fowl cholera, they basically just get arthritis and head tilting from infection of the inner ear. They don't get respiratory signs. As we see here, the chicks are okay. The adults in an acute form, they get hemorrhages and hemorrhagic diarrhea, conjunctivitis, dyspnea, and problem with the parenchymal organs. And in the chronic form, they get head tilt, which is like a CNS sign, affects the brain. They get edema in the waddle and arthritis. This is because in the chronic form, bacteria hides where the immune system can't access it, like in joints and the middle ear, as well as the meninges. And for the topic of Anati pestifer and Ornithobacteria rhinotracheale, just know that Anati pestifer is basically fowl cholera but for ducks and waterfowl. As we see here, Rhimelera Anati pestifer used to be Pasteurella Anati pestifer. However, in Anati pestifer, it's the young animals that are most severely affected, whereas in fowl cholera, it's the older animals. So they colonize the upper respiratory tract. If there's predisposing factors, they spread to the lower airways, and then they can enter the blood, where the bacteria is then lysed, and then the LPS is released. So they get diarrhea, nasal discharge, CNS signs. When it's chronic, they get arthritis. And for Ornithorhinotracheale, it's only a disease of the upper airway tract. They need the predisposing factors, and then they get sinusitis, conjunctivitis, and then a thick mucus plug, and it causes suffocation and irregular eggs.